So what we're seeing here is cupping for biceps femoris tear. The tear at this point is about 3 weeks old and has likely healed. And I know that because stretching and rolling are starting to have some positive effect for her, where in the past they had either a questionable effect or they might have actually, in some cases, stretching and rolling can actually irritate a tear. The tear is right here at the ischial tuberosity. This is the bottom of the pelvis, the bottom of the sit bone. And in this case, it's the outer hamstring or the biceps femoris, which is irritated. And also some of these small lateral rotators up here, like the obturator and maybe up into the piriformis, are also very tight and very irritated. This whole side, including the IT band and the medial hamstrings, are starting to spasm and react in response to this being unstable. It's been about 3 weeks. She's 50% better, which is great because that means that the tear is not that severe, but she feels like she's starting to stall and losing progress. So I think in 2, maybe 3 sessions, she'll be 90–95% better. At this point, I've recommended that she start using movements such as gentle yoga, walking, and a lot of stretching and rolling, especially on the IT band and the TFL muscle and the piriformis, in order to open the area up and start to rebalance it. And as she starts to use it, her nervous system, her body will start to retrain the area to fire normally. Any kind of activity which forces a sequential firing of the muscles, including walking conscientiously and yoga, will also help. So now what we're seeing is the central part of the treatment for the hamstring tear. The straining and the tearing of the biceps femoris insertion at the ischial tuberosity is all coming from misalignment of these last 2 vertebral joints, as well as misalignment of the SI joint. Her left hip bone, ilium and ischium, are rotating forward like this, which has the effect of pulling the hamstring, putting it on stretch all the time. And one reason it's called yoga butt is because if this muscle is already on stretch with such a misalignment, oftentimes people will go into downward dog or do a forward fold in yoga, and then that's where they pull that muscle. In her case, it wasn't sudden like that, it was gradual. She doesn't really know when it started to happen. It just became more and more irritated over time. But what I've observed is that with the piriformis, the lower lateral rotators, and especially with the biceps femoris, I'm getting a lot of really dramatic muscle twitches where the muscles are releasing very strongly. And so this is at the insertion of the tendon. This needle is about this long. It's going up toward the tendon. And then this one is just below the tendon. There was a tight, tender point there. That's a style of needling we often do. These 2 are both in the biceps femoris. That's the outer hamstring muscle right there. And I'm going to try to release those. You can see that they're just in the skin. So now I'm going to insert those and look for the twitch. And if I don't get the twitch, I'm not going to belabor it. Yeah. Is there a dull ache there?
Yeah, a little bit.
Yeah, so a little dull ache is fine. I'm not gonna repeatedly peck at it like that. So this would be enough to start the healing, but I'm gonna add some microstimulation, some heat, and then show her some joint mobilizations that she can do at home that should fix the problem and then prevent it from happening again.